Hi everyone, challenging session just after lunch, but let's move forward because we have our agenda, which is really interesting, but also packed. And the next session we have, it's the third session, which will be moderated by Rachel O'Donnell, Senior Research Fellow at University of Stirling and their colleague on many projects. And I'll pass to you to present our panelists.
I think we're on now. That's great. So I have the pleasure of introducing three speakers for this next session. First up, we'll have Angela Ciobanu, who's Technical Officer in Tobacco Control at the WHO Regional Office for Europe. She's got a long-standing history of working in non-communicable disease and communication for behavior change as well. And she's been working for the World Health Organization since 2011. We also have Maria José López, who's an associate professor and head of the Evaluation and Intervention Methods Service of the Public Health Agency here in Barcelona. And our third speaker is Michelle Kegler, who's come all the way over from the States, and she is going to be speaking about why smoke-free outdoor settings. She's professor in Department of Behavioral, Social and Health Education Services at Rollins School of Public Health at Emory University, and also director of the Emory Prevention Research Centre. So without further ado, given that we've started ever so slightly late, I'm going to pass over to our first speaker, Angela, to take the floor. Thanks, Angela.
Yeah, thank you very much for introduction. I will speak about the smoke-free environments and the implementation of the Article 8 in the WHO European region, and what are the barriers of the implementation and also enforcement of these measures at the regional level based on the reports and the countries that are reporting what is happening there. And first of all, I think that everyone knows and is well established that there's not a level that is not harmful. Even the exposure of to secondhand smoke, there's no level of that less harmful, but no harmful effect. That is all the biggest agency, the global agency, the International Agency for the Research in Cancer. They also group them that they first group of the carcinogens. There's a reports of their from the US that also mentioned that the exposure is very harmful, and it's killing every year around 1.3 million people. And out of these, 47,000 children under the age of 5. And the secondhand smoke exposure is harmful to the entire life course, starting from the pregnancy to the fetus, children, baby children, older adults, everyone have, its exposure is harm to the health. But most vulnerable, of course, those who cannot avoid it, for example, fetus or children that have to stay with the smoking parents around. Smoke-free policies, first of all, they are effective. They are saving lives. In the majority of countries, there was conducted the survey, evaluated the opinion of the people. There is high support of the smoke-free policies. More than 60, in some countries, even more than 80% of population are supporting smoke-free policies, and other countries are reaching even 90%. And smoking bans have a positive economic impact on the business and tourism and everywhere. And it's a question, why? And the last point is also implementation is very cost-effective, comparing with the investments of the cost that invest for the enforcement and what you gain out of the implementation of these policies. And is the question why their policies are implemented at so low level? Because in the European region, yes, from the 2008 until 2022, we have increased numbers of the countries who adopted comprehensive smoke-free policies. But in 2022, only 18 countries out 52 having a comprehensive smoke-free policy that is banning smoking in all public places, in the workplaces and public transport. What are the barriers that impede the countries to implement, and what also the opportunities to strengthen and to adopt the comprehensive policy? First of all, we discussed in the morning about the lack of political will and the stakeholder involvement. Even that everyone at the policy level and political levels knows that it's effective, it's saving lives, there is no safe exposure to the smoke-free, there is somehow there's level of the political will is quite low in some of the countries to adopt a comprehensive smoke-free policies. And there's, in the countries who adopted it, they show how to do it. And especially the opportunities to do is, first of all, to build a national coalition and inform the public, to build the strong arguments, and to inform that really this is effective and this is saving lives. Yeah, to raise the public awareness about the harm of the secondhand smoke and build the public support. And of course, we need for this the data. Monitoring is very important, and to bring and to inform the population. Media have a key role here in spreading the word, and many other activities. Another, we discussed in the morning a lot about the tobacco industries, and every time they mentioned that this is just, involvement of them in the smoke-free regulation is quite strong. And based on the experience of my personal experience, but also experience from other countries, even that at the level of the Ministry of Health, they're building and designing strong legislation that cover all the products, that cover comprehensively different all the places, and even some extension. One is coming to the parliament, and they're discussing there. They start to make exceptions, and there is a big battle, and the tobacco industry coming to their open discussion in the parliament with the big orchestra of the supporters and trying to downgrade the legislation. Therefore, there's involvement, it's at the big level. Of course, there's also opportunities every time to combat and to, but we need for this a strong public health institutions, specialists, again, coalitions, NGOs involvement, and to build the public support on this. And of course, we have to be very vigilant, and especially when the law is reaching the high level on adoption, to limit and to reduce the interference of the tobacco industry. And NGOs everywhere is very important component of this, because they are helping, and the medical association as well. Limited resources, I think, especially now when we have the many wars in the region, we have different economical impact. There's, especially the public health institutions have the limited resources on this, and limited not only the financial, but also the human resources who are working on this. In this case, we have to engage also as much as possible population, the specialists, the different level of the research institutions, the coalition is very important in order to help to deal with the limited resources. And also another issues, we can use the taxes raised from the taxes, some resources to have to engage some additional people for this, if it's possible. Many times, and I just came from one of the country from North Macedonia, where they in the law, they have a comprehensive approach to the smoke-free, but the law is not clear, how it's written in the law is not clear, is not understood well. And we have everywhere there are smoking. Therefore, it's even they have a good law, if it's not clear and have many loopholes, it can be challenged by the implementation level. And we have a just high-level policy discussion on Thursday, and they're planning to revise the law and to change it. This is just also an example from the Republic of Moldova that is coming to another point why it's also not well implemented. Here I presented the definition of smoking, and you see in the definition that is covering all the type of the tobacco product, but also the related products. And the related products are also the products that is herbal, products for smoking, products containing nicotine, including electronic cigarettes. It's covering all type of the products, and it's quite comprehensive. However, they have a case on the enforcement institution. They try to apply the law, and they put the fine on the agency who just found that they are smoking the shisha. And in the court, they nullify the decision of the applying these fines just because they mentioned that the investigating officer did not prove that hookah was not used with tobacco. And in the law, you saw that is practically it's covering also the related product, doesn't matter. It's with tobacco or not tobacco. Therefore, if there is a limited knowledge of the law, and the people or who is applying and who is also reading in the court this law have the limited knowledge, is put the barriers of the implementing this law. As a decision, for example, in the case of Moldova, they try now to stipulate in the law also hookahs as a wording with or without tobacco. They found another way, even they have quite comprehensive definition. In this case, it's also helping to have the guidance and the information how to implement the law at the low level. Comprehensive public education is also very important, and also awareness and media support. In terms of the enforcement of smoke-free measures, as I also mentioned that having the law on the paper, it doesn't mean that it's enforced. And we have also some examples in the region that on the papers, they're looking very well, but in practice is not enforced at all. And one of these examples is in Turkey. I think that everyone, they try, if you go there recently, they're smoking also everywhere. And also it's because the enforcement institution, there's existing one specialized institution who enforced. There was, this institution doesn't exist, and there was divided responsibility to enforce and to monitor to other institutions that practically don't fulfill their obligation to monitor and to enforce these measures. If there's division between different authorities, it's good to have clear responsibilities put on the paper, that everyone knows who is responsible for what, how the periodicity, how they'll do, and exchange the information. If that is not happening, it's not enforced at all. Also, NGOs, if it's not well involved, not informing the agencies, they're not right the issues, it's difficult to put it in place. Of course, it's good to have the tool-free telephone compliant hotline or the internet web page. In the Turkey also exists previously, but now is not working properly, and probably is not implementing it at all. Trainings, guidance materials, a design lawyer is also important to have. It's good to have, at least if not specialized, but to have a good reference if there are some court cases in order to help the public health or the enforcement agency inspections to implement it, help to go to all these court cases. Low level of fines and difficulties in applying penalties. This is another barriers of the implementing. And even some countries have high level of fines, but it's difficult to implement because the procedures of the applying is very complicated. And if it's applied, there's not finalized the final case that they are paying all these fines. Therefore, it's good to have a range. First of all, it's good to have a range of penalties that, for example, for the second violation will be higher, and or even higher on the third one, and even can lose the license for selling or for doing some practices. And and have to be applied not only on the entities, not only individuals, but all the entities. And have to be the shorter way of the application. From the application, when there's signed or put the fine, until there is paid as well. Monitoring evaluation really helped to strengthen and improve smoke-free policies, and also to do the periodical evaluation is helpful to understand what is the problem, where it is, and in order to address it. Because otherwise it will be difficult to understand how to redress the situation. And as I mentioned, also the comprehensiveness, because even a limited number of countries in our region have a comprehensive smoke-free policy that covers also the novel products. I mean, electronic cigarettes, heated tobacco, and so on. I also was recently in one of the country. We went in the restaurant, but even the corridor of the just entrance, they're smoking the heated tobacco products as usual. They mentioned this. By the law, it's not prohibited. We can. And therefore, it's important to have comprehensive, and also in terms of the enforcement, because when it's comprehensive, it's easy to enforce that all the type of the products is prohibited to use in the enclosed public places. Here, I just put the slide from the last global report on tobacco, and in the European region, we have only, in 2022, only 12 countries that have a full ban on the use of the electronic cigarettes in the indoor public places. Now we hope that will be increase the numbers. And the last, my key messages. This is one of the last slide. In order to have really good implemented good policy on the smoke-free, the law have to be comprehensive and have to be well enforced. And monitoring implementation, it's important. Thank you.
Thank you, Angela. So I think we've just got time for one or two quick questions before we move on to Maria's presentation. If anybody in the audience here in person or online would like to pose a question for Angela.
Yeah.
Yes, it's related with the previous table in the morning about compliance. I don't know if WHO or WHO could ask governments or parties about data like not self-reporting data, but data that really can show how is the situation in the compliance of several policies, including smoke-free policies. Do you have these mechanisms, or is it able to implement these kind of mechanisms at the WHO level or other levels?
Yeah, it's a good question, and we ask ourselves many times how to implement, how to do it in the best way. We have a mechanism, but it's not ideal what we are monitoring, because it's used at the global level. It's not on there. And in order to apply to all the countries, of course, the best way is to have the data from the national surveillance that assess the exposure of the people and reporting, how they're reporting the exposure to the secondhand smoke. But the country that has such kind of the data is very limited. Therefore, in the WHO, we usually use through the reporting system the report from the at least minimum of 3 experts at the country level who are reporting about the compliance. It's not ideal, but it's one of the ways to measure.
Do we have any other questions anyone would like to pose? No.
I had one question. Thank you very much, Angela, for presentation. You gave us a few examples of where enforcement does not work properly on smoke-free legislation in Europe. Would you flag a few countries in the European WHO region which you think are doing good, at least in some parts, or in particularly in enforcement? We know that sometimes what you said, legislation is one thing and the reality might be other.
Okay, because it's difficult to say, it's better to, okay, I don't have information from the countries, especially when you visit, we at WHO usually monitor at the policy level. We look through the policy. And it's difficult, and as I mentioned that some of the countries, they have comprehensive policy, but it's not implemented in the practice. However, many countries, some of the countries that I visited, even they have in the legislation some of the gaps, for example, designating smoking areas in the legislation, but in practices, they don't. One of the best examples that I will present as one of the standard is the Ireland. And why? And I'll explain why. Because they implemented the comprehensive smoke-free policies for the years, and now is self-enforced. At the moment that I visited the countries, they didn't cover through the smoke-free legislation the novel products, such as electronic cigarettes and so on, but I didn't see a person was smoking electronic cigarettes inside. None of them. And when I asked the enforcement inspectors there, they mentioned that it's automatically because they understood that none of the products have to be used inside. Therefore, if you put a comprehensive for the smoke-free policies well in place, it can be automatic, even the legislation doesn't cover. The people already, they're self-enforced. Thank you.
Okay, thank you. So I'm going to move on now to introduce our next speaker, Dr. Maria José López, who will be talking to us about the importance of smoke-free outdoor settings.
Okay, so, well, first of all, thank you very much for the invitation. It's a pleasure to be here with many colleagues and actually also with some friends. Okay, I'm going to talk about smoke-free outdoor settings, and I usually structure my presentations like with an introduction, some data, some results, and I finish with some conclusions or take-home messages. But today, I'm trying to be original. I'm going to spoiler my 5 take-home messages in the first slide. And after that, I'm going to show you for each message some data or some scientific paper, some scientific evidence supporting this message, right? And let's see how it works. So why are we, from a public health point of view, concerned about smoking in outdoor spaces, and therefore why we really want banning smoking in these spaces? First of all, I have here sometimes things like, okay, in outdoor spaces, usually the levels of secondhand smoke are very low, so these are not a real risk for health. And on one hand, as Angela said, no, it's a carcinogen, and therefore there is no safe level of exposure. But also, these levels in some outdoor spaces, like for instance terraces, might be very high. And I will show you some data in a minute. The second reason is that smoking in outdoor spaces goes against the normalization of smoking. No? We know that, for instance, children that usually see smokers, they have more chances of becoming a smoker when in the adulthood. So therefore, you have here another reason. Third one is that the current partial laws that we have in some outdoor spaces do not work. And I will show you some data. So we really need total ban smoking in these places. Fourth, smoking in outdoor spaces, especially in natural spaces like, let's say, beaches, have a significant environmental impact. And last but not least, smoking in outdoor spaces also contributes to health inequality. So it's not only a question of health, but also a question of equity and social justice. So let's see some evidence supporting these messages. The first one, regarding the levels of exposure in some outdoor spaces, is this paper that comes from the tax project that was actually coordinated by Esteban, who is here. And in this project, we measured the levels of environmental nicotine in terraces of hospitality venues from 11 European countries. And what we saw was that in those terraces, the second-hand smoke exposure was equivalent to the exposure in homes with smokers. Actually, I remember that the median nicotine concentration was 0.85 micrograms per cubic meter. That was exactly the same median nicotine concentrations that we found in homes of smokers. And we know that living with a smoker has important health risks. And actually, in some of the terraces where we have covered and we have more than 2 walls, this concentration was 3 times the concentration that we found in homes with smokers. And maybe someone could say, okay, but it's not the same to living with a smoker for a long time that to go to a terrace for a while, no? To take a beer, well, not a beer, I don't want to promote alcohol, to take a coffee, let's say, or to take a water. But something important is that the terraces are also workplaces, no? For hospitality workers. So this exposure is an occupational exposure, no? And then, for sure, we have to ban smoking in these settings to protect these workers also. So the second message, no, that smoking in outdoor settings goes against the normalization. Well, I just found this paper that was published the last year regarding a tobacco control law that was implemented in Colombia. They were banning smoking in several public places and also regulating tobacco advertising and tobacco promotion. And they saw that the smoking prevalence after the law was reduced in those households that were previously more exposed to the social norm by living close to highly dense commercial areas in the city. So somehow the message is the less visibility of tobacco, the better, no? And this idea can be applied also to outdoor spaces. Third, the current partial laws do not work. I wanted to show you this paper that we published this year, just some months ago. For those of you who are not familiar with the Spanish smoking control law, what our law said regarding the terraces of hospitality venues is that smoking is allowed on hospitality terraces if it is an uncovered space or covered with up to 2 side walls. So in the other terraces, you cannot smoke. So what we did was to study more than 100 hospitality terraces in the city of Barcelona. And from these terraces, 44 of them had a smoking ban. So in how many of them do you think that we saw people smoking? No? Saying in other words, what was the percentage of incompliance? Make a guess. Half? All? You must be from Barcelona. So 100% of uncompliance, no? And actually, that's not something new, because we saw exactly the same 6 years ago in the tax project when we were studying terraces from different countries where they have similar laws. So we know that this type of law do not work. We need a total ban in these settings. Fourth, regarding the environmental impact, I was doing a search in PubMed, and there are lots and lots of papers But I just choose this one, this review that was published this year in the Science of the Total Environment, that it's a very good journal. And just here you have some of the messages of the paper. Every year, trillions of cigarette butts are discarded into the environment. These butts have high resistance to physical and biological degradation, harmful components, and the list was very long of the harmful components released into water from butts, cause both water pollution and toxic effects on different aquatic organisms. And I think that now that we are all the day talking about One Health, and that we know that we cannot take care of people if we don't take care of the planet, that's also an important reason to ban smoking in outdoor spaces. And finally, also smoking in outdoor spaces contributes to health inequalities. And we have data on that, also coming from the tax project. I'm going to show you some data that we recorded in children's playgrounds, also coming from different countries, from 11 countries. And here you have some data. No? We were like systematically recording observational signs of tobacco consumption. No? And you can see that, for instance, we found that in around 20% of the playgrounds, we found people smoking, or we found cigarette butts inside the playgrounds in more than half of them. But look at what happened when we stratified this data, but by the socioeconomic level. So you can see in the purple line data in the least deprived neighborhoods, and in the brown line data in the most deprived neighborhoods. So you can see that always the situation is worst in the most deprived neighborhoods. So for instance, the cigarette butt come to 49 to 64, or people smoking from 22% to 27. And we saw exactly the same in another setting affecting children, like primary school entrances, when if we look at the people smoking in general, we found people smoking in around 40% of these school entrances. But if we stratified this data, and in this case, the most deprived neighborhoods is the dark blue line, we see that in the least deprived neighborhoods, only 32% of these entrances have people smoking, while in more than half of the most deprived neighborhoods, we found people smoking. So those children who already lived in the most deprived neighborhoods and who already have worse health indicators, they are also more exposed to the secondhand smoke. So, okay, so I think these are 5 important reasons to ban smoking in outdoor spaces and to keep moving towards smoke-free outdoor areas, no? And I think that in those outdoor environments where smoking is already regulated, first thing is that we need total bans, not partial, because as we have seen, they do not work. The second one is that in some places, like for instance, school entrances, I think it would be good to establish some perimeter so it's clear where you can smoke or where you cannot smoke. And we will need more clear signposting. And also that, as Angela was saying, no, that the law is not only a paper, so we need, let's say, either promotion programs or campaigns with an equity perspective so the people know this law and then it's easier, no? And we need to monitor and we need enforcement efforts, no? And then is when the law is really effective. And of course, we need to advance in implementing more smoke-free outdoor areas. We need more regulation, banning smoking in as many outdoor settings as possible. And just to finish saying that I have been talking about smoke-free environments, but of course, I mean smoke and aerosol-free environments, so we do not only have to ban smoking, but also to ban to use e-cigarettes or any other tobacco product. And that's all. Thank you very much for your kind attention.
Thank you, Maria. Just time for a couple of quick questions. If anybody has a question they'd like to pose to Maria. Any questions from the audience here or online? Go on, Angela.
Yeah, thank you very much for interesting presentation. You mentioned there about the monitoring that you did, the evaluation that you did, and the number of, there was 44, as I remember, the units of the outdoor spaces where the prohibited the smoking. But in these areas, there's how many had the sign, that the sign, no smoking sign that is prohibited?
No? Yeah, that's a very good question. For instance, in the case of playgrounds, when we were doing the field work, we have to look for the sign because we couldn't find it. And actually there was kind of a sign like this, and then it was like, you cannot throw things, you cannot enter with the dog, you cannot do whatever. And at the end, like, and you cannot smoke, but you need nearly like some glasses to see that. So really the signposting wasn't good. And in the case of terraces, there were no signs. And in the school entrances, there were no signs because it's not really forbidden. In some of them, because the school wants, they have some type of sign. But I remember very clearly the case of the playgrounds where it is forbidden by the Spanish law. But the signposting was clearly, we have room to improve in this sense. Yeah.
I think Esteba have one question.
Thank you very much, Maria José, for the talk and for showing us these results that I also believe that perhaps have prompted part of the current recommendations of the Commission. But well, it is clear that we have to legislate, and I said at the very beginning that legislation is necessary, but wanted to explain the case you mentioned now, that in playgrounds in Spain is forbidden and it's compulsory to be posted. But we also have even, I don't know, well, it's another place where everybody knows that is forbidden to smoke in the open air, that are the hospitals. All the premises outdoors in the hospitals, all the campuses, but the Spanish law bans the use of tobacco products and also e-cigarettes. It is very well signalized in almost all the hospitals, at least in Catalonia, and is always not complied by attendees, by even health professionals, but people attending the hospital, families of patients, etc. They look to one side, to another side, see that there is no police or security from the hospital or white coat around, and people smoke. You can see here, and in our experience, for example, in Catalonia, the Catalan Network for Smoke-Free Hospital has done big efforts to educate in this sense. And I believe that we also need to make behavioral changes in the population, to make these norms be accomplished. It's just a reflection. I don't know whether you want to, from the experience of the field work in the different places and so on.
Yes, well, no, was more or less one of the lines, no, of the last slide, that it's not only the paper of the law, but we have to do more things, no? Either campaigns or explain it, and also the equity perspective, and try to facilitate, no, that, because I guess that in the entrance of a hospital, people is in a very stressful situation, no? Or in those the private neighborhoods, I mean, people has very complicated lives, so the social determinants, and try to facilitate that the compliance of these laws. It's not easy, but we have to do also this part, no? And yeah, we have to advance on that.
Thank you. I wondered if I could be a bit cheeky as facilitator and just pop in one last question before we move on to Michelle. So I'll make it a quick one. So in Scotland, we have the tobacco and vapes bill, which is just going through the early stages of Parliament. And already what we've seen is that there was a proposal to restrict smoking in outdoor hospitality settings that now has been dropped. And so we still have it at the moment for hospitals. That's likely to be introduced, and I think playgrounds as well. But the proposal to restrict smoking in outdoor hospitality areas has gone, which we've heard is because of...
That would be great,
yeah. So you outlined some really neat, key arguments for why this is important at the start of your presentation, and I wondered, is there one or two in particular that you think are particularly persuasive for politicians?
I think the argument of the occupational exposure is, I mean, it's super clear, no? Yeah. We wouldn't allow in any other workplace to be exposed to a carcinogen. Yeah. So you have to use that. I think that's very powerful.
Thank you. Great. Okay, moving on, our last speaker of this session, Professor Michelle Kegler, is going to introduce us to smoke and aerosol-free private places with a focus on homes and vehicles. Thank you, Michelle.
Okay. Hello, everybody. So happy to be here. I'm going to talk about smoke-free private places, which of course is a little bit tricky because they're considered private and a little harder to regulate. So overall, I don't need to spend any time on this. Secondhand smoke exposure has decreased greatly in the United States and across the globe, which is really exciting. However, that means that one of the main remaining places where people are being exposed is in private homes. This is especially detrimental for children who are sort of captive in these environments where they're being exposed to secondhand smoke, and what can we as public health folks do about that? So one approach is to try to assist families in creating smoke-free homes. And so our surveillance systems do monitor smoke-free homes in the US. And when there's no one that smokes in the home, most of the households are smoke-free. So very strong norms around smoke-free homes if no one's smoking in the home. However, if there is someone who smokes, it's about 50% are still smoking in the home and exposing non-smokers in their environment to secondhand smoke. And then there's very significant disparities, which actually parallel cigarette smoking, related to socioeconomic status and racial ethnic groups. So our team, about 15 years ago, decided to try to take this on, beginning with qualitative work, understanding sort of the household dynamics of creating smoke-free homes. We developed an intervention called Smoke-Free Homes. Some things are better outside. We used humor, so you can see there's garbage in the home, there's a dog peeing on the couch in the home, and there's cigarettes in the home. And so instead of sort of bashing smokers about going outside, we tried to have a light-hearted approach. This program has now been recognized by our National Cancer Institute as evidence-based in helping households create smoke-free homes. It's a simple intervention. We designed it with scalability in mind. It's theory-based, takes about 6 weeks to deliver. It's a little old-fashioned, but it has a kit of materials that support us building a smoke-free home, including signage and stickers and a window cling, and then 5 steps to create a smoke-free home, 3 mailings and a coaching call. Coaching call is based on the trans-theoretical model stage of change, takes about 15-20 minutes, guides households through creating a smoke-free home, problem solves, asks what are the challenges of doing so, and then tries to come up with solutions, and then create an action plan for that family based on the challenges that they're facing. We wanted it to be easy to deliver in a range of settings, taking a public health argument that even if it wasn't as effective as a more intensive intervention, if it has greater reach, it would have a stronger public health impact. We were lucky to have a very large grant from our National Cancer Institute, and we're able to do 3 randomized controlled trials with 1 grant. And so we were able to do one where I live in the state of Georgia, one in North Carolina, and one with Texas, with increasingly diverse populations involved. And in each case, we showed that the intervention was effective with about a 15-20% absolute difference between intervention and control in households creating a smoke-free home. Participants interacted with the program well. what we were most excited about was it stimulated conversations in the household about the need to smoke outside instead of smoking inside. And about half were posting the signs, signing the pledges, posting the pledges, using the stickers, and then calling the National Quit line was something that we just mentioned, and about 20% were doing that. So because it's considered evidence-based, we're now in the process of adapting it for different communities and different countries. And so we're working with tribal communities or indigenous communities in the US, which still have a very high smoking rate in some nations. We're adapting it for Armenia and the Republic of Georgia. Dynamics are different there because over half of men are still smoking. And so we're getting into a little kind of gender-based decision-making a little more than in the US. Our colleagues here, and the reason I'm invited is because our colleagues here are adapting it for Spain. And then recently we have a colleague in Brazil that's going through the adaptation process. And there is a formal way to culturally adapt interventions, which most of the teams are following as they adapt the intervention. So just a quick minute on how we're adapting it for tribal communities. We did focus groups, and most of the teams that are adapting it are doing qualitative formative research to understand a little bit more about smoking in the home in their particular context, and then making the obvious changes to the materials, which is usually the imagery. Our typical house in the US doesn't really reflect the rest of the world. And even in tribal communities, they didn't like our humor, which makes me nervous because I don't know if it'll work without the humor. But anyway, so we went from funny, some things are better outside, to respect our past, protect our future. That's the theme we're using with our native communities, and you can see the imagery changed quite a bit. We're funded to work with some specific tribal communities now, partnering with Great Plains Tribal Leaders Health Board and Intertribal Council of Michigan. So we initially tried to make it sort of generic Native American, but then when we started working with specific nations, they needed to tailor it a little bit more. So we went through the process again and are tailoring it for specific tribal communities. We also have a project now. We're in probably our 7th or 8th year of research collaboration in Armenia and Georgia, and we're working with the CDC in Georgia and the NIH and the CDC in Armenia, and we're adapting it using the same general process in those countries. In that case, though, the national quit lines are going to be the ones delivering the intervention, which has more potential for scalability. And here you can see just some of the preliminary work in adapting it for their communities. One of the challenges we faced is we're getting pretty good at getting research dollars to test the intervention, but in order to have a public health impact, you have to have it integrated into a system of some sort, and that's where we've gotten a little bit stuck. Again, we have a research project here where we braided it with a parenting program for households that are, the families are involved with child protective services, so child maltreatment, just kind of bad family dynamics where they get involved with the court system. And we are integrating our Smoke-Free Homes program into a parenting program there. We braided them, and we're implementing it in that setting, which has potential for dissemination. Our approach, though, is household by household by household, which is quite slow. So I thought I should just mention that national smoke-free legislation also seems to increase smoke-free homes or decrease smoking in the home. There's like a spillover effect. So that's another approach. And then there have been a few studies that have shown just community education is effective in increasing the rates of smoke-free homes. We did that recently in a community randomized trial where we formed multi-sectoral community coalitions that did community education around secondhand smoke exposure in Armenia and Georgia. Our public health sector, though, in our CDC is not so much focused on household by household program-specific things, but trying to do more policy-related work in this space. And so far, California is doing a good job of this. The rest of the country, not so much. All of the legislation related to smoke-free multi-unit housing is in California. So 85 municipalities have successfully passed city or county ordinances banning smoking in private units of apartment buildings, basically, whether it's rental or owned. So that's exciting, but it really takes a political will to go there. Another big success that we've had in the US is our federal agency, Department of Housing and Urban Development, mandated that all conventional public housing be smoke-free. This was around 2017, implemented in 2018, and this was a really big deal. So this was, again, a policy that promoted smoke-free homes. It did, and the public health folks weren't too happy about that, but it did exclude vaping and e-cigarettes to get it through. There is a lot of work encouraging voluntary smoke-free multi-unit housing. We're running this for the state of Georgia, where we're trying to work with organizations and companies that own apartment buildings and have them create smoke-free policies at the building or the property level. And so we're doing a recognition program so that those that have completely smoke-free properties, including outdoors, get a gold designation, and then we put them on this interactive map, so if people want smoke-free housing, they can find it. We're also doing a marketing campaign related to that. And then, as has been talked about with the previous speakers, compliance and enforcement is an issue with all of these efforts to create smoke-free policies. And so different public health groups across the country are trying to provide support for cessation and enforcement of these policies at the property level, and we're doing that as well. Some of you might have noticed that our Surgeon General just came out with a new report about 2 weeks ago. This was on health disparities related to tobacco, and I just pulled a quote related to the smoke-free homes section. And so they said, future efforts should employ a three-pronged approach, including the voluntary adoption of rules for a smoke-free home at the household level, smoke-free policies in multi-unit housing, and then comprehensive smoke-free legislation. So that's kind of what our government is saying are the three ways to promote smoke-free housing at present. I was asked to talk a little bit about smoke-free vehicles, and there is some international momentum in banning smoking in private vehicles when a child is present. I'm wondering if we could use that same, I don't know the politics behind creating political will for that, but if it's protecting children, which it must be, because it's specific to children, I wonder if we could harness that for smoke-free homes in some way. Not sure about that. And it's a little bit slower. Well, I guess it's kind of slow globally, but there's 12 states in the US that have passed similar legislation at the state level. There is also some evidence of a spillover effect where when smoke-free homes are created, some folks actually then also make their vehicles smoke-free as well. So some of the smoke-free homes interventions might assist with this. And we're testing an explicit smoke-free homes vehicle education campaign right now to see if that helps with any of this. And I just want to close with a few sort of reflection and discussion points. I won't take the time to go through all of this, but in terms of the program that we've generated, I think it really, in order to have a public health impact, we need systems to implement it, because sometimes it's hard to find families that admit to still smoking in the home, and it's pockets of populations, at least in our country, where people are still smoking in the home, so you need to have an end to certain population groups in order to do that. And then there is public health energy around smoke-free multi-unit housing. And then I think an area that's interesting to think about is how to handle vaping and aerosol and e-cigarettes in the private setting. Should the messaging just be no tobacco use in the home at all, ever? Or should we start with combustible products, get those out of the home, and then add e-cigarettes? I think is worth debating. So that's all I wanted to cover.
Thank you, Michelle.
Oh, I wanted to acknowledge most of our funding was from the National Cancer Institute, and then I have a really fantastic core team.
Thanks a lot. So we've got a good couple of minutes if anybody has a question that they would like to ask.
Excellent. That was really, really interesting. Thank you. So really interested in all of your intervention work, really interested in all of your education work and information work. And I guess I'd like to just ask you a little bit more about legislation, oddly enough. And so I wondered about enforcement of that legislation. And is that essential, or is legislation in and of itself almost enough in altering norms, social norms around SHS exposure in the home?
Legislation in this area seems like a really big deal. So I don't think we want to get hung up in thinking, oh, there's so many enforcement and compliance challenges, let's not do it. I think when the planning for implementation is done well, and we've done some qualitative work on enforcement and compliance and setting up policies and implementing policies in a way that they roll out effectively, I think when done well and supported by the public health community, we can see higher compliance, and then we can make the enforcement compassionate. It is harder, and we've struggled with that too, because when you pass a policy in housing, it ends in eviction if people don't obey the policy. And of course, as public health people, we understand that housing is a critically important public health need. And so we're trying to experiment with sort of, making the enforcement process other than just, referring, because now people get referred to cessation, but then they don't quit. And, it's hard. But I think if you build in a careful enforcement process, and we're going to try sticking our program into that enforcement process where people have to get referred, to a smoke-free homes program where they get more intensive support. But I say let's not give up on policy.
Any other questions?
I think
A quick one. Thank you, everyone, for very interesting presentations. Michelle, one for you. It's great to see that smoke-free homes, this project initiative, gathers interest also outside the US. So, and the question is related to this. So, how do you ensure that adaptation of the materials to local context maintain core effectiveness of the intervention? So, thank you.
Yeah, and I'm kind of struggling personally with how much, how carefully we should be involved and make sure that's done, or whether we just put our program out there and people do with it what they will. We're kind of at a sweet spot now where we have an agreement that we sign with whoever's going to adapt it, and the agreement includes the core elements of it. And then we offer, for the most part, we're offering training on the coaching. If it catches on further than that, we are, thinking about automating and posting training for how to do the coaching and make it a little more scalable. But as of now, you have to contact us for the materials, which allows us to gain, to ensure that it's done well. But I don't know about doing that for a long time, and I don't know if it'll ever, really catch on. Right now, it's small enough that we get to know the teams that are doing it.
Okay, so I think we have one online question too.
We have a question from Raquel Fernandez. She's asking, have you on the US addressed the problem of secondhand smoke on homes when the smoke comes from other homes, especially in multi-housing buildings? And she says we have a huge problem in Spain.
Yeah, so that's where most of the public health people are working, where they try to they try to get the property owner to adopt a policy that makes the entire building smoke-free. And that's been somewhat successful. It is, Sean asked me this about disparities earlier. new housing is new multi-unit housing is largely smoke-free because people don't want the damage and the stink and the turnover costs related to smoking in particular units. Renovated housing is tending to be smoke-free, but it's the older housing that's cheaper where people are still allowed to smoke, and then that's where lower income people work and where the disparities are getting exacerbated, I would say. So it's a challenge in lower income places, but yeah, I mean, all the state health departments get complaints about neighbors breathing secondhand smoke coming from the unit next to them, which is an argument for a policy to create the whole building to be smoke-free. In other countries, I've learned, like in Armenia and Georgia, it's hard to identify who owns the building because people own I don't know how it is in Spain, but people own their flats, and so it's not clear who has the authority to create a policy for that building or that property. So maybe others have figured that out, but just as that kind of an outsider to this system, I know that we have similar condominiums where people own their units, and then there's like a homeowners association, and they can decide to make the entire building smoke-free.
Great, thank you. So that brings us to the end of our third session. Just like to close by giving another round of applause of thanks to our speakers. Thank you.